Go straight and talk to Ivy Brenda Cherotich right now. She's in one of our studios here at Citizen Television. Ivy Brenda, good to see you. Apologies for the social distancing, but thanks so much for making it.
Thank you, Jeff. Nice to see you too.
Nice to see you. Listen, real quick, how are you feeling, first of all?
I'm feeling perfectly okay right now. I don't have any pain and I'm just fine. No fevers, no headaches.
Okay, real quick, I'm going to ask you an embarrassing question, but it's for your generation to know. How old are you, Ivy Brenda?
26 years old.
26. Yes. Okay, so take us through exactly what happened. So you were in the U.S., right?
Yes.
Go on, take it from there.
So I was in the U.S. and I took a flight from Cleveland in Ohio to Chicago, Illinois. And then from there, I took a flight to London. Then from London, that's when I came to Nairobi.
Did you stop in London or was it just transit?
It was just a transit, so we had a 1 hour layover.
Okay. Yes. So you come to Nairobi and you're fine, you're feeling okay. Yes. And then what? How did you... You said you heard through the media that you were patient number one. Tell us about that.
So when I landed, we were screened at the airport. Everybody was screened, and our temperatures were perfectly okay. We were all within the normal range, and that's when we took our luggage, and I proceeded to Rongai. And so a few days later, I would say about 3 or 4 days, I felt a tickle in my throat. Then that tickle turned into a cough within about 5 hours. So then after the cough, it lingered on for the whole day, and it was a very, very mild cough, which you wouldn't think it would be something that's so serious. Yeah. But then because I had stayed in that time in the country for a couple of days, then I knew this cough was not the one from taking flights and jet lag. So that's when I called the other passengers who were seated next to me on the plane, and I asked them if they were having a cough or a fever, because I knew there was that possibility. So when the people who were seated next to me, one of the ladies confirmed, and she told me she had been having a fever for a number of days and a cough as well, and she told me that there was something weird with the cough. That's when I decided to just, stay in isolation in the house and not go anywhere until and to watch my body. So that's when the next day I proceeded to call the toll-free number. I contacted the hospitals, and then I went to the hospital myself.
Brenda, that's very brave of you. I mean, what made you walk into Mbagathi? Because a lot of people watching you right now, they may be feeling those symptoms. They may be, experiencing some of those symptoms. And they wouldn't dare walk into Mbagathi. What made you do that?
Well, for me, I was conscious. I was health conscious because, I knew this was something that was highly contagious. And there was a possibility if it was corona, then I didn't want to go on infecting other people and probably getting it all around the country to vulnerable people. So for me, that was something that I was most concerned about, protecting other people as well. Did
you talk to your family members, your dad, your mom, if they're still around? Or did you talk to anyone that's saying, look, I'm going to Mbagathi, I'm going to make this conscious decision?
I did not tell anyone. I just called the people we were with, a few friends that we were with in the house, and we discussed about it, and they assured me that they would be there for me in case of anything. And we had agreed that in case it turned out positive, then they would also come forward and say that they had been in contact with me, and also give the authorities and the Ministry of Health every person that they had been in contact with. That was the initial agreement. So they really pushed me and supported me all the way.
Okay, so you walk into Mbagathi, what happens?
In Mbagathi, first of all, the customer inquiries, they didn't think it was that serious. So they were like, oh no, you can go to Kemri or you can go some other place. I'm sure they'll give you the assistance. But I insisted and I said I want to be tested because I've had a travel history. So when I got to the isolation center that I'd read about on the media while I was back in the US, I went to the isolation center and I talked to the nurses there, and they handed me a mask. They called KNH and an ambulance took me to KNH. That's when I stayed in isolation and I was tested the next day.
And
that the next day I didn't get my results. So then the doctor comes in at night asked me what kind of shopping I would like to stay comfortable, because I'd just come with my handbag and my purse, that's all. So then the doctor says, okay, Ivy, I just need you to be relaxed a little. So by that time I hadn't told any family members. So the next day when I saw it on the media that when the CS was announcing that there was a positive case of a 27-year-old lady, that's when I kind of put the dots together, put 2 and 2 together, and realized it was me.
What was going through your mind, Ivy? I mean, you must have been going crazy with all these thoughts, and this could be the end of the world.
I was scared. The first thing that I did when the lady who was seated next to me on the airplane called me and told me, I think there's someone on the news they're talking about. It must be you because you had told me you wanted to go to the hospital. And I said, yes, I'm in isolation. And she said, I think it's you. I told her, no, it's not me. Trust me. I don't have that virus because, you know, I'm not presenting. I don't have any difficulty in breathing. But she insisted, and that's when I started seeing the calls coming in, and I broke down. I started crying. And, you know, I was calling the nurses all over the hospitals and asking them, is it me? Are you sure it's me? And the nurses, I remember there wasn't a nurse on the other side, but then when I looked out through my window, I called the nurse, and one of the nurses, she kind of, from where she was, she went away towards the gate. And that's at the point when I really knew it was me, because why would a nurse be walking away? Yeah. And I think she was a little, maybe scared, because it's something new. They haven't dealt with it before.
Good Lord. So 23 days. I mean, what do you do for 23 days in there? Talk to us about it. What do you do? 23
days are long. They are long, Jeff. But then that's a sacrifice that everyone has to take. We all have to be, you know, painfully uncomfortable just during this period so that we can achieve something. For me, it was to achieve, you know, to be isolated, for the virus to be contained and suppressed so that I wouldn't give it to other people. So for 23 days, I was just putting my music on, talking to my family members. My family was very supportive. Because I was crying sometimes.
Ivy, did they give you any drugs in that period? I mean, from day 1 to day 10? I mean, did they give you any hydrochloroquine? Did they give you anything during that period?
I'm not a medical expert, but I'm sure they had the best treatment, because I know they were keeping in contact with the Chinese experts, medical experts, researchers. So they gave me antibiotics. And they also gave me multivitamins, vitamin C, and a lot of fruits. They also gave me food high in protein, because they took my blood sample, remember? So from the blood sample, I think that's where they can see what they need to, you know, give you and at what amount. So I would say that was very helpful.
Yeah, was it at some point, did you think, my goodness, you know, day 10, 11, 12, 13, do you think, I could die here, huh? I mean, this could be the it.
Yeah, the first day when it came out on the media and I found out from the media, I thought, I didn't think I was going to live, to be honest. Because I didn't think, that's the first reaction somebody has, because this is a pandemic, to be honest. Everyone will be scared at the first point. But the more the nurses talked to me, they used to come a lot of times during the day and at night, and they would comfort me, talk to me, tell me they would walk me through the journey, and even show me examples of people who've pulled through. And I was also seeing it from YouTube. I was watching people who had survived COVID-19, and I was getting some tips from them. You know, drink a lot of warm water and take a lot of fruits, listen to the doctors. Yeah.
So you had access to your phone, you could call family, you could call friends, you could keep in touch, you could do all that?
Yes. I did. I had access. I had my phone with me. I had my laptop. I even asked the doctor to get me a book and a pen.
And you wrote down some thoughts?
Yeah, I wrote down my thoughts. So,
okay. Enter Brian. Who is Brian Ondiri to you?
Brian is, I came to know Brian's name when I saw him being brought into the isolation ward. So that's when I realized this is someone who I had seen coming into the house for 1 or 2 instances. And that's when I realized, because I had told my friends, when the ministry calls you and asks anybody who's been in contact with me or anybody who's come into the house, then we must make sure that we give them all the information. And my friends did it. So Brian was one of the people who came into the house.
And what about the rest of your family? Mom, dad, siblings? Where are they?
They are back in Kericho, where they live, and I have a brother who lives in Nairobi, one lives in the US, and I have sisters in both Mombasa and Kericho. So I never met them. I never went home. I just stayed in Rongai the entire time.
So when they heard that you were in isolation, what was going through their minds? What did they think? What did they tell you?
They were very scared. They didn't believe it. They didn't think, actually, nobody thinks this virus is so real until it happens to someone who's close to you. So at first they didn't believe it. They didn't think I was in the isolation. I had to convince them, but from the crying, they could tell that this was so real, that I was actually the patient zero. Yeah.
So when they declared you negative this morning, or was it yesterday? How did you feel?
I was very happy. And I had, you have to be tested negative. You have to be tested twice, and it has to be 2 consecutive negatives before you're released and declared that you're recovered. So the first one, when it came out negative, I was assuring the doctors, I was telling them, you know what, the second one is going to be negative. Believe me, I'm going to do everything to make sure it's negative. So I would, drink a lot of water, warm water, take a lot of fruits, and follow every instruction that they had, because that's very important as well.
So they release you, you go back to, I think you were in Ongata Rongai, if I'm not mistaken. You get to your apartment, if you will, and how are the people there treating you? Are people running away? Were the people scared? Or what were people saying when you're coming back?
People, when I was released, I went directly to the CS's office. We had a discussion and the video conference with the president, and that's when I went back to the house. So Ken H took me back to the house, and I remember the guy at the security guy at the gate. He was like, are you bringing someone who is sick? And the nurses said, no, we are bringing you someone who was sick but has been put under treatment and is completely recovered. So we are not bringing in any sick person. That's a person who's already recovered.
What about your neighbors, Ivy?
I'm thankful. My neighbors are really nice. My neighbors have a positive attitude right now towards me. Yeah.
Wow. You have a good attitude too. Well, Ivy, don't go away. Stay right there. We're going to come back with Dr. Lois Ombajo, okay, very shortly. So hang tight, okay? Keep smiling. Well done. Good job.